Children's Hospital here does a wonderful job of looking after conditions in condition-specific clinics. The family comes in, they spend half a day or a day at the hospital meeting all these different disciplines, and then they get a comprehensive report out of that. Once they turn 16, or maybe if they can persuade the hospital to go till they're 18, they lose that kind of clinic experience, and they have to find each of those modalities on their own, separate appointments. And this is especially problematic for people who are from out of town. And sometimes the problems overlap between two disciplines, say between neurology and orthopedic surgeon, and they can't just go across the hall or across the examining room in the specialized clinic to discuss the common areas between the two of them. In order to serve this group better, certainly one answer is specialized clinics. So for example, at St. Paul's Hospital now we have a cardiology clinic for adults that have had repairs of cardiac anomalies as children. So involvement of family physicians as a family physician to these problem children at a much earlier age. Maybe even throughout their course in the hospital, so that you're a team member from the beginning. What might be needed in more rural settings than my experience here in Vancouver? For that, I would say one is funding for families so that they can come down for appointments. Sometimes there's just services you can't provide in the north. Nowadays you can also do video conferencing more easily. A lot of the community colleges have facilities, hospitals could have them. Part of what's needed in a systemic way is facilitating communication. It's the ability to talk to people you need to talk to or make appointments when you need them. Fee-for-service could work, salary could work, sessional could work, but each one of those people can be good or bad. A difficult area is the development of sexuality in children with disabilities. The need for starting the process of giving independence to children and helping them to make the transitions from childhood to adulthood.